Your heart is racing, your chest feels tight, you're lying in bed at 2 a.m., convinced that something is terribly wrong. You rush to the ER, they run tests, and everything comes back normal. It's just anxiety, they tell you. Try to relax. But here is what they are missing. This is not just anxiety, it's your hormones. I'm Dr. Indrani Raman, and today we are talking about anxiety and heart palpitations during menopause, why they happen, the science behind them, and most importantly, what you can actually do about it. I have been seeing so many of these cases in my clinic, and this is why I felt the need to really talk about this. I'll share the story of Rebecca. She's a 48-year-old marketing executive who came to me terrified. For 6 months, she had been experiencing sudden panic attacks, racing heart, anxiety symptoms. She never had that before. I've always been the calm one, she told me. Now I feel like I'm losing my mind. I went to the ER twice thinking I was having a heart attack. And her cardiologist found nothing wrong. Her primary care doctor prescribed her anti anxiety medications, but no one connected the dots to her perimenopause. So, after we addressed her hormonal imbalances, Rebecca's anxiety decreased by 80% within 8 weeks. Her palpitations stopped, and she finally felt like herself again. And I've seen this so many times, and this is why I want to share this. If you're here with me, stay in there. I'm going to talk more on really what's happening and the connection with estrogen. I'm also going to share the tips what you can do to prevent that. You see, estrogen doesn't just control your menstrual cycle, it's a powerful mood regulator. It also is responsible for a couple of neurotransmitters, the serotonin and dopamine. Serotonin keeps you calm, happy, balanced, and estrogen increases the serotonin production and helps your brain to use it effectively. GABA is your brain's natural calming chemical. It quiets the anxious thoughts and prevents your nervous system from going into overdrive. Estrogen enhances the GABA receptor sensitivity. So, as estrogen drops during perimenopause, your brain loses that calming support, and the result is sudden anxiety, panic attacks, and a feeling that your nervous system is on fire. This explains why women who have never struggled with anxiety suddenly they find themselves overwhelmed, and it's not a personal failing, it's biochemistry. So, the heart palpitations during menopause happen for three specific reasons. Reason number one is, of course, lack of estrogen, because estrogen directly affects your heart rhythm too. It is responsible for regulation of your autonomic nervous system, the part that controls the heart rate. So, when that fluctuates wildly during perimenopause, the heart rhythm also becomes unstable. You experience skipped beats, racing heart, or that fluttering sensation. Reason number two, adrenaline surges. Adrenaline is a part of the stress hormones. So the declining estrogen also triggers your adrenal glands to release more of this to compensate. These surges cause the sudden heart racing and sweating and the feeling of impending doom, exactly like a panic attack, because it's supposed to is a fight or flight hormone. Reason number three, magnesium deficiency. 75% of menopausal women are deficient in this mineral essential for rhythm regulation. Without this, the heart rhythm can become unstable, causing palpitations. The terrifying part, these symptoms can feel exactly like a heart attack, but they are hormonal, not cardiac. And here is where it gets worse. Anxiety and palpitations create a vicious cycle. So your hormones trigger the palpitations, you feel scared, then your body releases more adrenaline, your heart races faster, your anxiety intensifies, then more stress hormones, worse symptoms. You see the pattern? This is why just relaxing doesn't work, because you're not causing this with your thoughts. It's your physiology, your hormones are driving the bus. So I'll share 5 strategies to help reduce with this anxiety and palpitations. And these are actionable and they will also address the root cause. Number one, we need to stabilize that blood sugar. The low blood sugar crashes trigger adrenaline release, which causes both anxiety and palpitations. So every time your blood sugar is dropping, your body perceives it as an emergency. And the way to tackle that is make sure you are eating importantly protein at every meal. Especially when you work out and as breakfast in the morning is the most important meal. Definitely eat protein within the 90 minutes of waking. And try not to go more than 4 hours without eating, especially if you know that you are very sensitive to the blood sugar crash. Avoid caffeine on an empty stomach. And we are all guilty of this. A lot of women I know are not hungry in the morning, so the first thing they go for is coffee. And this may not be good for you. So that single change itself actually reduced Rebecca's palpitations by 50% within 1 week. So strategy number 2, supplementing importantly, because I think there is a lot of important micronutrient deficiencies that I see in this age group in general, and targeted supplements and nutrients can dramatically reduce these symptoms. Number 1, adding that magnesium, especially magnesium glycinate or threonate, are really good for nervous system. So adding that in the dose that is ideal for you. Commonly we use 400 to 600 milligrams before bed. It calms the nervous system, regulates the heart rhythm, also helps with the restless legs too, and improves sleep. So the glycinate form is the one that's best absorbed and doesn't cause any digestive issues. Number 2 is omega-3 fatty acids. Usually in our practice, we use 1000 to 2000 milligrams of EPA or DHEA daily. That has been known to reduce inflammation, stabilizing mood, and also supporting heart health. Number 3 is vitamin B6. It can be taken as part of B complex, and this vitamin has been responsible to support serotonin production, and it also helps to process estrogen metabolites, especially women who struggle more with headaches, migraine headaches. This can be an important vitamin to supplement. Strategy number 3, master your nervous system. You can think your way out of hormone driven anxiety, but you can definitely regulate your nervous system, especially the sympathetic nervous system that is on the overdrive. Have you ever heard about 478 breathing? There's a great video by Dr. Andrew Weil on YouTube about this. I highly recommend you look at that to look at the practical aspect of this. But basically, it is as follows. You breathe in through your nose for 4 counts, you hold it for 7 counts, and you exhale through your mouth for 8 counts. And you can repeat that for 4 times. You can even do this when you wake up in the nighttime and you are trying to fall asleep. The 478 breathing helps quite a bit. What it's doing is activating your parasympathetic nervous system, which reduces that vagal tone. So your body's natural calming down mechanism is happening. It also helps to lower that cholesterol, lower that cortisol levels and adrenaline within minutes. Do this when you start feeling that palpitations coming on. Do it before bed, and you can do it several times throughout the day. Strategy number 4, time your exercise wisely. As women go through 40s and 50s, perimenopause and menopause age, high intensity exercise may not be the best for us. It can in fact worsen anxiety and palpitations, especially when your hormones are already unstable and your body is in a stress situations. So these intense workouts can feel as additional stress. So do give the body the rest that needs. And what might be better if this is happening for you is maybe just doing some gentle stretching or going for morning walks, especially exposure to sunlight and sunset is important to regulate the cortisol, gentle yoga, and maybe strength training too at moderate intensity. But avoid intense cardio workouts and high intensity workout during those high anxiety periods. And save that after your hormones are more stabilized. It doesn't need to be the first thing that you're going to do. I hope this is resonating with you. Hang in there. I have one more tip to go here. Number 5, and most importantly, consider bioidentical hormone support, because we need to do that advanced testing and really personalize this for you. For many women, replacing their declining estrogen is the most effective solution. Bioidentical estradiol restores that calming neurotransmitters, the serotonin and GABA, and it also supports your brain needs. That means even your cognitive function will improve with hormone therapy. And this is not a band-aid, it's addressing that root cause, the most important root cause that needs to be addressed, because the declining estrogen is what brings on all of these things. And I'll say not everyone is a candidate for hormone replacement therapy, but if you're experiencing debilitating anxiety, palpitations, it is worth discussing with your provider who's knowledgeable in menopause therapy or somebody experienced with that. And I will also share this important aspect when to really see the doctor immediately if you're having any of these symptoms. Because while most palpitations during menopause could be hormonal, I definitely see a doctor if you experience these dangerous signs. And we need to get that aspect also cleared, right? If you're having chest pain or pressure, shortness of breath, dizziness or fainting spells, and palpitations lasting more than a few minutes, irregular heartbeat, and irregular heartbeat along with other symptoms, you need clearance and you need the testing, EKG and Holter monitor and all of those things. So your heart needs to be checked out first to rule out cardiac causes. And once that is clear, then we can confidently address that hormonal component. So keep that in mind. So if this resonates with you guys, I highly recommend you checking out our link for the free discovery call to see if we can help you. And remember, Rebecca, after 8 weeks of stabilizing her blood sugar and also taking magnesium and omega-3 fatty acids and practicing that nervous system regulation and starting bioidentical estrogen, this is what she told me. I feel like a completely different person. I finally sleep through the night. I'm not having any panic attacks anymore and have not even felt those palpitations in the last 3 weeks. Any stress at work and any stressful situation at home, I'm able to do much more better than I did before. I feel like myself again. And I actually feel better now in my 50s than in my 40s. And this is possible for you too. So if you're experiencing anxiety and palpitations and those are disrupting your life, I want you guys to know you don't have to figure this out alone. Most importantly, this is not your personality change. There is a biochemical process that's happening. So do check out the link we have to set up a complimentary discovery call where my team will talk to you, see what's going on with your health, and they will also talk about the next step if you want to proceed further about a consultation. And if this was helpful to you, I recommend to share with anybody else, other women who may be going through similar symptoms that I mentioned here. So I want you guys to know this is menopause. During the menopause phase, I want you guys to know that you are not broken. You just need a reset, and we can help you. And if you are still looking for further advanced testing and hormone testing and targeted supplementation, other interventions, just so you know, those are possible for you too. I invite you guys to set up your call. Take care.